Yes, so the new guidelines for heart failure, I think, represent another win for the ACC, American College of Cardiology, and cardiovascular healthcare professionals around the world. And that is simply because these are downloadable. They're in an easy knowledge chunk format of bytes that can be easily disseminated on your smartphone to the point of care. Professionals in the office, healthcare providers in the hospital, or in any setting can make this information readily available. And what we know is that actually, since they've been released this year, this is the most downloadable piece of information from the ACC in the science arena to date. And there were well over 25,000 downloads of this information, which is a really high amount for healthcare professionals of these guidelines. So I think that everyone is trying to change with the times and trying to get this information again to the point of care where it can be used most effectively in taking care of our patients. So that's really wonderful. The other point I might want to talk about is the ACC is also involved not only in STEMI care in the United States, but now are trying to scale internationally to other countries throughout the world, and particularly not so much Western Europe, which has great heart attack care as well right now, but to the LAMI, the low and middle income countries throughout the world, to try and develop systems of heart attack care, because again, this is one of the groups that is at highest risk, those with heart attacks and STEMI. And so we are working with our international partners. The ACC has now over 40 chapters, other countries throughout the world. It is one of the highest distinctions for cardiologists in other parts of the world to be associated or have the ACC distinction. And working with them, we are trying to partner with them to help develop regional systems of care to help treat patients immediately at the site where they are, and then also transport those patients for definitive care and set up these systems of regular pathways for their treatment so that we can reduce heart attack mortality worldwide.